Hi friends, welcome back to my YouTube channel. So first of all, please subscribe to my YouTube channel. Then coming back to our today's topic is diseases of spinal cord. Number 1, spinal cord injury and its types. Number 2, neuromuscular junction. Number 3, peripheral nerve ligaments. Number 4, its symptoms and its treatment. So let's start the video. So the diseases of spinal cord. Here are some diseases and disorders that affect the spinal cord. Number 1, spinal cord injury, SCI. Number 2, spinal cord trauma, SCT. Number 3, spinal cord tumors, SCTs. Number 4, spinal cord infarction, SCI. Number 5, spinal cord abscess. Number 6, spinal cord cyst. Number 7, spinal cord hemorrhage. Number 8, spinal cord compression, which is the compression of spinal cord. Number 9, spondylosis. Number 10, spinal stenosis. Number 11, spinal fractures. Number 12, spinal infarction, for example, meningitis and abscess. Number 13, inflammatory diseases, for example, multiple sclerosis, MS, transverse myelitis. Number 14, congenital disorder, for example, spina bifida, tether cord syndrome. So these are the diseases of spinal cord. Now what are the symptoms that we see in spinal cord injury? Number 1 is pain, numbness in the back, neck and extremities. Number 2, weakness or paralysis in the arms and legs. Number 3, difficulty walking or maintaining balance. Number 4, loss of bladder or bowel control. Number 5 is impaired breathing or coughing, sensory loss or abnormal sensations. So these are the symptoms that we see in the spinal cord injuries. Now what are the treatment of spinal cord diseases? Treatment of spinal cord disease and disorder depend on the specific condition, severity and location. Here some common treatments options are: number 1, surgery, tumor resection. Number 2, decompression, for example, limectomy. Number 3, stabilization, for example, spinal fusion. Number 4, instrumentation, for example, rods and screws. Number 2 is medication, which is the most important of any kind of injury. Number 1 is pain management, for example, analgesics, muscle relaxant, anti-inflammatory drugs, for example, corticosteroids, antispasmodic drugs, for example, baclofen, antiviral or antibacterial drugs, for example, for infection. And number 3 of the treatment of spinal cord injury is rehabilitation, which is the most important for any kind of injury. Physical therapy, for example, exercises and stretches performed. Number 2, occupational therapy, for example, daily activities, adaptive acquirement. Speech therapy, for example, communication and swallowing. Number 5 is respiratory therapy, for example, breathing exercises and ventilation are performed. The second topic of today is peripheral nerve lesions. Peripheral nerve lesions refer to damage or disorder affecting the peripheral nerves which connect the central nervous system, brain and spinal cord to the rest of the body. Here some example of peripheral nerve lesions are: number 1, neuropathy, diabetic neuropathy, peripheral neuropathy and mononeuropathy. These are the type of neuropathy. And in mononeuropathy we can see carpal tunnel syndrome, CTS, in this type of condition. Next one is nerve compression or entrapment, CT, carpal tunnel syndrome, cubital tunnel syndrome, tarsal tunnel syndrome. Number 3 is nerve damage or injury, traumatic nerve injury, nerve laceration or transection, nerve stretch and contusions. So these are the injuries we can see in peripheral nerve lesions. Number 4 is inflammatory disorder, Guillain-Barré syndrome, chronic inflammatory. Number 5 is tumor, benign nerve tumors and malignant nerve tumors. These kind of tumors in tumor are the types of tumors. Number 6 is infection, laparoscopic lymph disease, herpes simplex virus. Number 7 is autoimmune disorder, multiple sclerosis and rheumatoid arthritis. These type of diseases we can see in different peripheral nerve lesions. Now moving toward symptoms of peripheral nerve lesions. Number 1 is numbness, tingling, pain or burning sensation, weakness as paralysis, muscle atrophy, sensory loss or impairment, reflex changes or loss. Now moving toward our third topic is neuromuscular junction. Neuromuscular junction is the site where the motor neuron terminates and form a synapse with the muscle fiber. So first we see the basic definition of neuromuscular junction. Now we see its function. It is critical structure that enable communication between the nervous system and muscles and allowing the muscle contraction and movement. What is the process of transmission of neuromuscular junction? Number 1 is action potential reaches the perisynaptic terminal. Number 2, release of neurotransmitter, for example, acetylcholine. Number 3, binding of neurotransmitter to receptors on the postsynaptic membrane. Number 4, generation of muscle action potential. And number 5 is muscle contraction. So this is the basic process that we see in neuromuscular junction transmitter. Now What is the dysfunction? Dysfunction at the neuromuscular junction can lead to the various neuromuscular disorder such as number 1 is myasthenia gravis, number 2 Lambert-Eaton syndrome, number 3 botulism, number 5 amyotrophic lateral sclerosis ALS. So these are the disorder that we see in neuromuscular junction or dysfunction. Now the next topic is diseases of voluntary muscle. Diseases of voluntary muscle is also known as skeletal muscles, can affect the muscles that are under voluntary control. Here are some examples of diseases and disorder affecting a voluntary muscle. For example, number 1 muscular dystrophy. Duchenne muscular dystrophy, one of the most severe form of inherited muscular dystrophies. Limb-girdle muscular dystrophy, large group of genetic diseases in which there is a muscle weakness. Number 2 is muscular atrophy, disuse atrophy, neurogenic atrophy, a loss of muscle mass and function. Muscular atrophy due to aging. Sarcopenia is the age-related progressive loss of muscle mass and strength. Number 3 is muscle injuries. Muscle injuries in which we see muscle strain and injury of muscle or tendon. Number 2, muscle contusion and injury of the soft tissue. Muscle laceration in which we see occurs when the muscle is cut by the external object. Number 4 is inflammatory myopathies in which polymyositis. Number 2 is dermatomyositis, including body myositis. Number 5 is metabolic myopathies, microarterial disease, glycogen storage disease, POMC disease, lysosomal storage disease. Number 6 is a neurological disorder, amyotrophic lateral sclerosis, ALS, spinal muscular atrophy, peripheral neuropathy. Number 7 is autoimmune disorder, myasthenia gravis, and Lambert-Eaton syndrome. 8 is infection, viral myositis, bacterial myositis. Number 9 is toxin myopathy, alcohol-related myopathy, and statin-related myopathy. Number 10 is congenital disorder, congenital muscular dystrophy, congenital myopathy.